In Tokyo, athletes' dreams of Olympic golds crushed after testing positive for COVID-19. White House officials catching the virus too, even after being fully vaccinated.
The official remains off campus as they wait for a confirmatory PCR test.
The headlines seem endless, but they are actually part of a very rare group who have had breakthrough infections, testing positive for the coronavirus more than 14 days after being fully inoculated. The CDC no longer tracks all breakthrough infections, but NBC News found 27 states tracking them, tallying up to more than 65,000 cases over 6 months. That still only represents a fraction of the more than 162 million people who have received the vaccine. The CDC is tracking breakthrough cases that involve hospitalization or death. The agency has reported nearly 6,000 of these cases so far, in which a fully vaccinated person with COVID-19 was hospitalized or died. That's only 0.004% out of the millions vaccinated. 74% of those patients were over 65.
The vaccines were never designed to prevent infection, right? They were designed to prevent severe disease and death. That's what you want them to do.
The majority of these breakthrough infections are mild or asymptomatic.
They tend to have what looks more like a head cold, right? They'll have nasal congestion, they'll have sore throat, they have a little fever.
Those being hospitalized and dying from COVID after vaccination are the high-risk populations that have been largely affected by this disease the entire pandemic. People 65 and older, or those with weakened immune systems. And while breakthrough infections can occur, it doesn't mean the vaccine is no longer effective. Of course, we know that this virus can spread even if the carrier is asymptomatic. But there's also growing evidence suggesting fully vaccinated people have a lower viral load, meaning they're probably much less likely to transmit the virus, even if they do test positive. And because of that, some doctors, including myself, believe we need a new term for some of these cases. A fully vaccinated person with no symptoms who is testing positive for COVID-19 should not be called a breakthrough infection or considered a positive case if it's unlikely they'll spread the virus. The question becomes how to describe these cases. There's not great terminology in the medical community for it, and it certainly isn't something there's likely to be agreement on anytime soon. Bottom line, the vaccines continue to be one of our strongest weapons against this virus, including the more transmissible Delta variant.
If you're not vaccinated, the Delta variant is going to find you and you're going to get infected. And you may end up really sick. You may end up really sick in the hospital. I think that's what people need to worry about.
Dr. Gupta joins me now, and I have to say, Dr. Gupta, everything that you just said in that story is hitting so close to home for me and so many friends that I know. I'm hearing about people who are fully vaccinated, who have been exposed to COVID, even through other fully vaccinated people, and it's causing a lot of alarm, unfortunately. So I'm glad you're here. You just mentioned how rare breakthrough infections are, but experts tell NBC News that we're going to see more of them in places where vaccination rates are low and the Delta variant is spreading. So if you're vaccinated, but let's say you're at a higher risk of bad outcomes from COVID, say you have a pre-existing condition, something like diabetes, are you more at risk then for a breakthrough case?
Good afternoon. Thank you so much for having me. You are. You would be considered immunocompromised, and it's a long list actually of conditions that fit under that label of being immunocompromised. And so I would encourage all your viewers to talk to their doctor. Maybe they've recently had cancer and are on chemotherapy or on high doses of steroids. That all qualifies, and you would be considered immunocompromised, and you should be masking in public settings, even if you're fully vaccinated, or if you're over 65. We know for everybody else, though, that even if you do test positive, that the chances that you're going to be sick enough to go to the hospital or even to transmit the virus are very, very slim.
And as the pandemic goes on, we've heard more about long COVID, so people experiencing symptoms way after they've tested positive, like long-term lung damage. So is that something that people with breakthrough cases should be concerned about, especially since most of these breakthrough cases are asymptomatic?
I think this ultimately comes down to what do we know? We know that long COVID sometimes can impact those who are unvaccinated, who end up having mild symptoms up front, and then they develop these long COVID-like symptoms over the course of many months, as you just mentioned. It's unclear how often this actually happens amongst the fully vaccinated. There are anecdotal reports. It seems exceedingly rare, just like if you end up in the hospital with severe COVID pneumonia, exceedingly rare. So this all really comes down to risk tolerance. Risk is never going to be zero for development of any of these conditions. But if you're otherwise healthy, less than 65, the chances of any of these things happening, if you've gotten 2 doses of a vaccine, are exceptionally rare. And we need to feel comfortable with that guidance.
So these mask mandates in a lot of states have been going away. People are getting back out there, getting back to living their normal lives. And we're seeing the resurgence of something else, the common cold. What's your advice as far as when vaccinated viewers should get a COVID test? I mean, if you have symptoms, or even if you have been exposed to someone who has the virus, should you just run out and get a test immediately?
If you're fully vaccinated, to answer your second question first, if you're fully vaccinated and you're in close contact with somebody who you know has COVID, no, you do not, unless you develop symptoms. So unless you develop symptoms, if you're asymptomatic and you're in close contact, don't worry about it, especially if you're fully vaccinated. That's the key piece. If you've developed a cold, a runny nose, fevers, chills, a shortness of breath, really any of the COVID-like symptoms we've been talking about for the last 20 months, you should get tested just for your own peace of mind. And especially if you have, say, unvaccinated kiddos at home, it's good for you to know whether or not you might be positive and potentially, even though this is rare, potentially transmissible to those in your family who might be at high risk or who have yet to receive the vaccine. So that's the key piece there. So any COVID symptoms, do go ahead and get that test just for your own knowledge and the well-being of your family.
And just a bit of a follow-up to what you just mentioned there. So if you're vaccinated, but let's say you've been exposed to COVID, or I guess I'll just ask you straight up, like, when should someone isolate if they're vaccinated?
They should only isolate if they have symptoms. The CDC has come out with clear guidance that if you're fully vaccinated 2 weeks after your last dose of the vaccine, and I firmly believe that you need 2 doses of the vaccine, so we can talk about what that means for the one-shot J&Jers, but if you've got 2 weeks after your second dose of the vaccine, even if you've been in close contact with somebody, only isolate if you are developing symptoms. If you're asymptomatic, you do not need to test, you do not need to isolate.
Dr. Gupta, thank you so much for all that clarity and advice that you just offered us there.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.